My name is Mackenzie Meldrim. My student ID is 3254433, and this video is for my VTHT 1341 class.
So today we're going to be going over the admission of a patient for surgery. We are going to be taking in a 10-year-old female domestic short-hair cat. Her name is Ginger, and she is coming in for a mass removal that is located on her right hip. So first thing we are going to do, we have a consent form for treatment. As you can see, it's for a mass removal, and we have it on the right hip, right back end. We've already confirmed the location with the owner. And as you can see, the owner has already signed everything. She said yes to unexpected life-saving care, which is always a concern, you know, with anesthesia. And then she signed her name, she dated it, and then she also put her primary number. We also had her sign a consent form, and it has everything that we're going to be including in the surgery today. So placing an IV catheter, giving fluids, anesthesia monitoring, and then the tissue biopsy and any care afterwards. She also brought in a e-collar that the cat is going to be wearing on her way home. So if we look at her permanent patient records, we can see in her diagnosis that she does have a history of a mast cell tumor. It was low grade, but the pathologist did say that there is cause for concern that it would regrow, which is what we're suspicious of today and why we're going to be removing this mass. So this is her history with us, and I think her last surgery to remove a mass was back in 2020 in May. So I can look back and see that. And then I also see that she's up to date on vaccines and such. So we also have patient discharge information. We have information as opposed for her diet, so she should have a normal, she can have her normal diet tonight when she is discharged, but we want to give small amounts. And we are also giving her a non-steroidal anti-inflammatory drug called Onsior. So we're going to be dispensing that to her, and we're going to explain to the owner what she should be looking for as far as side effects. So any lethargy, vomiting, diarrhea, any not wanting to eat. And then she should also look for irritation or redness around the incision site, and just make sure that nothing is going on there, then make sure the cat is not trying to scratch at it. Okay, so before we took the cat in, we also did pre-anesthetic blood work, which we can see over here. So we did it through IDEX. So we can go ahead and take a look there. And for the most part, everything looks to be okay. There were some values that were like a little off, but the doc inevitably gave the okay that she is okay to go under anesthesia, so we have that on file. And then we also have our form from IDEX for the biopsy, so right now it's in progress because we haven't sent it out yet. And then lastly, we have our anesthesia monitoring sheet. So this is how we're going to monitor anesthesia while she is in surgery. So we would have her name, the type of procedure we're doing, which is a mass removal. She's a feline. We would put the date, her weight, and then isoflurane would go up here. And then we have heart rate, respiratory rate, blood pressure, ETCO2, SpO2, and then we would take her temperature every 10 minutes. And then all these other values would be every 5 minutes so that we can keep track of her values during surgery. So while we're getting ready to intake our patient Ginger, I've gone ahead and made a cage form so that we know who is in what cage and there's no confusion. So here it has her name, first and last name, the procedure that we're going to do along with where the procedure is taking place, which is the right hip. And then at the time, she didn't have any medications. We are going to be dispensing Onsior to her along with her discharge information. And then we have a note that she is getting an e-collar, so we don't forget that. So I'm going to go ahead and place this here. And then when we take her in, we're going to be putting her into this cage. All right, so I'm going to show you how to restrain for the jugular vein on a dog. So I have Hazel here. I have her more or less backed up into a corner so she can't back up. She's in between my legs. And what I'm going to do is I'm going to hold her head up so that the person who's taking the blood has access to the jugular vein, and I'm just going to hold her here like this. So next I'm going to demonstrate how to restrain for the cephalic vein. So I'm going to go ahead and hold the dog's face away so that they don't have the access to bite the person who's taking the blood. And I'm going to take the leg and use my thumb to pull back the skin and hold off the vein. And then you can see that the cephalic vein is ready to have blood being taken. All right, so now I'm going to demonstrate how to restrain for the saphenous vein. So I have the dog lying down laterally on its side, and I have my arm over the neck so they can't move their head, and I have my hand holding the leg that's closest to the ground so that they can't stand up, and I'm going to take my hand and kind of hold off on the vein there across, and then you can see the cephalic vein that the person can take the blood from. So I'm going to demonstrate how to put a patient into a kennel and then how to take them out again. So I have my slip lead leash here, so I'm going to open up the door, and it's going to go right on in, and I'm going to slip the lead right off and shut the door. So now that the dog is in the kennel, I can take my slip lead. It's large enough to fit around her head, so I'm going to open the door and slip it right around, and it'll tighten like that, and then she is ready to go out. So I'm going to demonstrate how to properly and safely muzzle a dog. So I have Linda helping me hold him. She's making sure that, you know, he's not going to move away, and I have my muzzle, and she's going to hold his face forward, and I'm going to bring it below so that he can't see it, and put it on his muzzle. And then I'm going to go ahead and tie it back around his ears, over his ears, and put it in place. And now we have a dog that can't bite us. So I'm going to apply an Elizabethan collar or e-collar to the patient. So most important thing you want to remember is you don't want their nose sticking out, because if their nose sticks out, they can turn around and potentially get at any wound or suture that you applied. So I have already measured this. So as you can see, I'm going to pull the ears out. Rocky can't get to anything, his nose isn't sticking out. So I'm going to take our non-stretching gauze and wrap it around. And you can also apply it to the collar as well. And that way it is a little loose, but if I tighten it, he shouldn't be able to get out of it. And I can also tie it to his collar as well.
So now I'm going to do a physical exam on a dog, and I'm also going to obtain the TPR, that's temperature, pulse, respiration. So first thing I'm going to do is listen to the heart, and I want to listen on the left side. I'm going to count every love dub that I hear as 1 beat. I'm going to count that for 15 seconds and then multiply that by 4 to get my beats per minute. So I got 32 times by 4. That's 128, which is normal for a small dog. I actually did hear some whooshing going on there, so that is indicative of a heart murmur. And if I listen on the other side, I'll see if I can hear it there as well. So we'll indicate that under abnormalities as well. That. And it was actually pretty loud. Okay, next I'm going to listen to his lungs, and then I'll also listen to the other side to see if I can hear the murmur on the other side of the chest. And I'm also going to watch his breathing and count that as well. Okay, so I did hear that same whooshing noise on the other side of the chest, so it is a pretty moderate heart murmur. And then his lungs they sounded normal. There was no crackling, no wheezing, anything like that. And I got about 5. Oops. So that's 20 for respiration, so that's normal. And we'll do temperature last, since most animals don't really appreciate that. So now I'm going to move on to the physical exam. I'm going to look at the eyes. Just want to make sure that there is no any ulcers, any scratches, anything like that. I'm going to look for any discharge of the nose, look in the ears, make sure there's no discharge or redness there. Oh my. Take a look There's some very mild tartar, barely anything. See the other side. Boy. And then capillary refill time is less than 2 seconds, and his mucous membrane is nice and pink and moist. Look inside, everything looks normal there. And feel for his lymph nodes. They're both symmetrical, and I can feel them, but they're not too big. I already listened to his heart and lungs, so now I'll go ahead and palpate his abdomen. Look for any masses there. Abdomen is soft and pliable. Do a range of motion. Boy. It's normal there. Okay. Underneath, he is a neutered male, about 10 years old, mixed breed. We'll check his underneath as well, check his belly. His coat is nice, there's no hair loss, it's not dry or anything like that. And his body condition score is nice. I would put that at a 5. He's got like a nice covering over his ribs. I can't really, he's got a nice waist. And so he's also a BAR, that's a bright, alert, responsive. So besides the heart murmur, everything else appears normal, but because that heart murmur does compromise certain things when it comes to anesthesia, I would put his ASA score at a 3. So now I am going to complete our TPR by doing the temperature. Our temperature here. Good boy. Good job. And our temperature is 101.0. That's normal for a dog. Anything above 102.5 is considered a fever, so his temperature is normal, and we'll indicate that in our paper. Okay, so now I'm going to do a physical exam and a TPR on this patient here. It's an 8-year-old spayed female cat, medium hair. So first thing I'm going to do is obtain a TPR. That's a temperature, pulse, respiration. So I'm going to listen to the heart and lungs first. When I'm listening to the heart, I am going to go ahead and listen for 15 seconds, listen for each beat, and then multiply that by 4 to get my beats per minute. So go ahead and do that. And I want to listen on the left side. Come on, kitty. So I got 46 for 15 seconds. And that's 184, and that's within normal range for a cat. Okay, so I'm just going to write that down there, beats per minute. Now I'm going to listen to the lungs, and I'm also going to pay attention to her breathing just out here. I'm going to listen to for any crackling, any wheezing, anything that sounds abnormal, and then I'm going to count every inhale and every exhale as one breath. Okay, so stupid mask. So that was 12 breaths times 4. That's 48. She is a little stressed, so it is higher. Normally, when they're at rest, a cat is going to breathe between 15 and 30 breaths per minute. So we'll go ahead and write that. And then we're going to save the temperature for last so we don't make her angry. So now I'm going to move on to the physical exam part. So I'm going to start at the front. And I'm going to take a quick look at the eyes, make sure I don't see any ulcers, any scratches. They look pretty good. Look for discharge in the nose. Look in the ears, make sure I don't see any discharge or redness there. I'm going to look at the teeth. And I'm seeing very minimal tartar here. Her capillary refill time is less than 2 seconds, so that's normal. Go ahead and take a look in the mouth. Everything looks normal there. Her mucous membrane is nice and moist, normal color. So now I've already listened to the heart and lungs, so I'm actually going to switch with you again. I'm going to look at her coat. Everything looks pretty good here. She does have a lesion right over here by her neck. We're going to take a closer look at that. But everything else besides that looks pretty good. Everything back here looks normal, and then I'm going to palpate her abdomen. Make sure I don't feel any masses. Kitty. Everything feels normal there. As far as body condition score, she seems pretty ideal, so I would give her a 5. She's got a nice layer over her ribs. I don't really have to palpate to feel them, and she looks good there. So as far as like her attitude, she is BAR, bright, alert, responsive, and taking into account everything that we've seen here, minus the temperature, which we'll do in a moment, I would give her an ASA score of 1. And now we are going to take her temperature. Save the worst for last. I actually find it in all this fluff. Okay, so she's 101.1, and that's a normal temperature for a cat. Anything above 102.5 is considered a fever. So now I'm going to take the blood from the cephalic vein of a dog, so I'm going to go ahead and do that. And the strainer is going to hold off on the vessel, and we're going to let that down with alcohol. And with the bevel up, I'm going to put my finger in front of the vessel so it doesn't move. Once I have enough, I can pull off the vessel, and the restrainer can hold off the vein.
Okay, so in this video, I'm going to demonstrate how to take blood from the jugular vein on a canine. So first thing I'm going to do is take my syringe out. I'm going to bend the needle a little bit so I can get a better angle. And then I'm going to let down the fur. Visual, and I'm going to place my thumb across the thoracic inlet so that I can feel where the vein would be. And then I want my needle bevel up. Oh, you're doing a good job. And then when I take my needle out, I'm going to put my thumb over it so that we can clot. Okay. So I'm going to get blood from the saphenous vein. It's the lateral saphenous vein on a dog. So I'm going to wet the fur down so that I can see it. And I want to put my finger in front of the vessel so that it doesn't roll away. And then I want to come in kind of sideways there so the vessel doesn't continue to roll. So it's going to go bevel up. Oh, good girl. And once I have all I need, I can put my finger over the needle and pull out. So now I'm going to get blood from the cephalic vein of a cat. I'm going to use a 1 cc syringe because I don't need very much. It's going to roll off for me. Out of here. And then we'll do it. So now I'm going to get get blood from the jugular vein of the cat. So first thing I'm going to do is I'm going to bend my needle a little bit. Get a better angle, and I've shaved the spot already. So I'm just going to put alcohol there. And then I'm going to place my thumb across the thoracic inlet so that the vessel pops up. And with my bevel up, I'm going to place it here. Good job. Okay, so now I'm going to get blood from the medial saphenous vein on a cat. This cat is a little fractious, so we're going to use a butterfly. So I'm going to lay down the hair first so I can visualize that vessel. Here. And now I'm going to take my butterfly. Okay, kitty. Remove my needle. And with the bevel up, I am going to place it into the vein. Hold on, kitty. It's okay. It's okay. Good girl. We're going to wait until it gets to the very end there. Good kitty. Okay, and then I'm going to take my butterfly and we're just going to hold off. When a young healthy animal is a candidate for surgery, hospitals will do something called a minimum database testing, and this would include doing packed cell volume, total solids, blood glucose, blood urea nitrogen, and alanine aminotransferase. In addition to these 5 tests, if the animal presents with an abnormality during its physical exam, or if it's an older animal, like if it's geriatric, if it's sick, if it's injured, hospitals may decide to do additional testing on top of the minimum database. So these tests could include a number of blood tests like CBC, serum chemistry, thyroid panel, electrolytes, clotting panels, testing for heartworm and feline leukemia virus, and then also doing other diagnostics such as ultrasound, radiograph, or echocardiogram, and again, this is all having to do with certain abnormalities found during the physical exam. So today we have a canine coming in for a standard neuter. So for our pre-anesthetic and our anesthetic protocol, there's a few different things that we're going to be doing to maintain that this animal has correct anesthetic safety throughout the entire procedure. So for our pre-med, we're going to give IM we're going to give dextromethorphan, and we're going to give hydromorphone, and the dextromethorphan is for the anesthetic effect, and hydromorphone is for the analgesic effect to basically give preemptive pain management before the procedure starts. So that'll be given IM. About 15 minutes later, we will place an IV catheter into the cephalic vein, and then we were going to give our induction agents, which for this procedure is going to be ketamine and midazolam. It's a combination. Once the patient has been induced once they've been induced, they are going to be maintained on the inhalant anesthetic isoflurane, and that's going to be throughout the entire procedure until the end. And then before going into surgery, we're going to give a local block at the incision site, and also we're going to give the local block testicularly as well, right into the testicles. And so after the procedure, we are also going to send home pain medicine, so that once the initial pain meds from the hydromorphone wear off, the patient is still feeling comfortable at home,
So that's going to be the NSAID carprofen. And that entire process is going to be our anesthetic protocol for a canine neuter.
So now I'm going to make an entry in our controlled substance log. So first thing I'm going to do is I'm going to put the date and then the patient's name. And this patient happens to be a feline. And now, so this is for ketamine, so this cat got a 0.15, 0.15, excuse me, 0.15, so I'm going to put that in our amount used. And then I'm going to subtract the amount that was left from last time, so from what I used. It's going to be 3.91, I'll put that there.